For the next few minutes, I will talk to you about the prime booster strategies in viral infections and particularly about the application of these strategies to pest control. First, I would like to make a short review on the development of the immune response because this will be one of the critical elements to understand this type of strategies. When we talk about the development of an immune response against a pathogen, we are mainly talking about the interaction of antigen-presenting cells with T and B cells. The first action that we will have after the entrance of the pathogen in the body will be the antigenic presentation and cooperation. That means that antigen-presenting cells will signal T cells for the presence of the antigen, and then B cells will recognize also this antigen and will cooperate with T cells. The second action in this development of the immune response will be the expansion and differentiation of T and B cell clones. These cells usually undergo a polarization. That means that they specialize in doing some particular actions, what we call the Th1 cell-mediated, Th2 mostly humoral, the T follicular, Th17 or Treg, the specialization or polarization. B cells will become plasma cells that are specialized antibody-producing cells. And the third step is the development of memory cells. And we have different types of memory cells depending if we're talking about T or B cells. Within T cells, we have memory cells that are central, memory cells that have also effector properties, T cells that have memory capabilities, but they reside in the peripheral of the body, or we have T cells that are resident in the tissues, and this will be very important for the clearance of the infection, particularly in the lung. Within B cells, we will develop long-lived plasma cells or germinal center memory cells that are the main cells that maintain B cell memory in the organism. The prime boost concept is based on this immune response. After the first encounter with the antigen, the first vaccination, we have a development of effector memory cells. But if there is no antigenic restimulation, this response will eventually decay and eventually will fade out. So that means that we need some strategy, some type of a strategy for inducing a boost of this immunity, avoiding this contraction and this eventual decay. In other words, the first vaccination will produce the priming of the immune system, while the second vaccination will produce the expansion of the pre-existent memory and effector cells. Although after a prime boosting strategy, we can observe a decline of the response, the result is that the effective, that is the response that is able to counteract the infection, will persist for a longer time. But we have to stop here for a moment. Prime boost strategies and primary and secondary doses of a vaccine are not exactly the same. In some cases, when we start a vaccination schedule, we need to receive 2 doses. A first dose, time 0, and then a second dose, usually 2-3 weeks after the first. We have to be clear that in these strategies, the second dose is administered when the immune response is still increasing. Both doses, the first and the second, are required to produce effective immunity. In the prime booster strategy, the approach is different. Note that the second dose in this type of strategies is administered when the immune response is starting to contract. So what we want, our intention here, is to boost this decaying response. Another important point that we have to understand is that different types of vaccines against the same agent may induce different types of immune responses. If we take a look at this table, we can see some of the most commonly used types of vaccines. Some vaccines, like the live-attenuated vaccines or the mRNA vaccines, for example, the COVID vaccine from Pfizer or Moderna, or the vector vaccines that contain a replicative agent, mostly induce cell-mediated immune responses plus antibody responses. The reason for this is that in these cases, the antigen is produced usually by replication. This wouldn't be the case with mRNA that uses a different mechanism, but in all cases, the antigen is present in the cytosol of the cell. And as a result of that, this presentation, the antigenic presentation, may happen by means of the class 2, but also the class 1 histocompatibility antigens. As a result of the infection, we have also soluble release of soluble antigens that will induce humoral responses. In contrast, when we have inactivated subunit or toxoid vaccines, that, to say so, they are just proteins with no replication, the agent is present, or the proteins of the agent are present in the extracellular compartment. And that means that the antigenic presentation is performed by class 2 alone. In this case, where we have soluble antigens in the extracellular space and antigenic presentation by class 2, the result of the immune stimulation is mostly the production of strong humoral responses. So in other words, the same agent, live or inactivated, may produce different responses in the individual. Another important point when we talk about the type of immunity induced by the vaccines is that different types of vaccines may contain different types of agents. And this is pretty clear for the comparison of the live attenuated vaccines versus inactivated vaccines. Let's take a look, for example, to PRRS or to the arteriviruses. In this figure, you can see the replication cycle of equine arterivirus, the prototypical arterivirus that is very well known. In this case, the virus infects the target cell, the capsidates and codes, and we can find then the genomic RNA free in the cytoplasm. This genomic RNA, mostly three quarters of the genome, encodes for what we call non-structural proteins. Proteins that will be involved in the replication, but that will not be present in the full and assembled virion. As a result, during this replication, inside the cytoplasm of the cell, we can find several polyproteins against which the immune system will develop an immune response. Beyond that, the immune system will also recognize the structural proteins, and that will lead to a wide panel of antigens recognized after the infection or eventually a vaccination. In a different situation, when we use an inactivated vaccine, the whole array of antigens that we have are those contained in the assembled virion. So no immune response against these proteins is formed. Some of these proteins, some of these non-structural proteins can be very important for the development of an immune response, particularly for the cell-mediated immunity. Let's take a look at the types of prime booster strategies that we can apply. And the first point is to distinguish between what we call homologous and heterologous prime boost. The homologous prime boost is intended to reinforce or to maintain the immunity against a given antigen or set of antigens. In other words, it's kind of a recall stimulation of the immune system in which we want to boost the preformed response against a given set of antigens. This type of strategies, using the same antigen for priming and for boosting, is very efficient for B-cell responses, but is less efficient with T-cell responses. Then we have the heterologous prime booster strategies. These heterologous prime booster strategies may apply to two different situations. The first one is when we use two vaccines made with different technologies. For example, a live vaccine first and then an inactivated, an mRNA vaccine and then a vectored vaccine, and so on. Or we can apply this concept in a different way. We can use two vaccines having different antigens. The result of these two strategies will be different. In the heterologous prime boost, in which we use two vaccines with different technologies, usually what we want is to complement the immune response, inducing, for example, cell-mediated immunity with the first and boosting the humoral response with the boosting dose. In the second strategy, using two vaccines with different antigens, what we want is to widen the number of antigens that the immune system can recognize. And this, for example, can be interesting for agents with a high antigenic diversity. However, there are several factors influencing the prime boost strategies. The first one of them is the order of the vaccines used. Usually, for optimal results, live mRNA or DNA vaccines In other words, these vaccines that are producing something inside the cell are administered as a priming, while inactivated or subunit vaccines are usually used as a boost. The opposite, in general, is less effective. The second is the amount of antigen. For example, very high antigenic doses for priming may result in a strong response, but of short duration. In contrast, low antigenic doses may produce poor booster. So again, it's a matter of balancing the amount of antigen and the order of the vaccines. The third element is the use of adjuvants or other cofactors, because adjuvants are substances that can critically influence the development of the immune response. Same antigens with different adjuvants may produce different results. And fourth is the type of memory that we want to boost or we want to prime. As we saw before, the immunological memory have different actors. T memory cells, B memory cells, central memory cells, peripheral memory cells, tissue resident cells. Different strategies may result in a preferential development of one type of cells or the other. The problem here is that we are not very clear about how to prime or how to produce or how to boost specifically one type against the other. Let's see some current examples of these prime boost strategies, and I think that COVID-19 can be an example. In this paper, the authors examined the available literature about these prime boost strategies in COVID, and they were comparing the AstraZeneca vaccine, that is a vector vaccine, compared to the Pfizer-BioNTech vaccine, that is an mRNA vaccine. As you can see, a single administration of one or the other was little able to induce high neutralizing antibody titers in combination with what we can call homologous booster, or indeed in this case would be more secondary dose, compared to the heterologous booster that was very efficient. Particularly the first one in this case was the AstraZeneca vaccine, was very efficient in inducing neutralizing antibodies. If we look at the T-cell responses, for example, it's pretty clear that the combination of vaccines was superior to the administration of a single vaccine or a combination of the same vaccine in a two-dose scale. Let's take a look to some prime boost strategies in PRRS. And in this first paper that I would like to bring to your attention, Geldof and coworkers from Hans Nauwing Group showed and tested the concept of boosting using an autologous vaccine. In this study, they identified 3 farms in which they isolated the virus that was present, 3 different viruses, 1 in each farm, and then they boost those animals in the farm using different strategies. When they use a control, placebo, very little change from the beginning after the administration of the control. When they use an autologous inactivated vaccine, the result was a clear booster for the 3 farms. That makes a lot of sense. I mean, the administration of the inactivated vaccine made with the virus circulating in the farm boosted the immunity of the animals that had been in contact with that strain. Then they use a commercial inactivated vaccine. In one case, the booster was clear. In another case, was not that clear. And in the third case, there was no booster, indicating probably the correspondence, the antigenic correspondence between the strain circulating in the farm and the antigens present in the commercial vaccine. And when they use, for example, an MLB for PRRS1, the results were similar. In one case, there was a good booster. In another case, some boosting effect, and in the third case, almost no booster. When they use a commercial MLB for PRRS2, the result was no booster at all. So in this paper, the authors show very clearly that the use of autologous vaccines, inactivated vaccines, was able to induce an increase in the humoral response of those animals. These are neutralizing antibodies. The second paper that I would like to bring to your attention has been recently published by us and deals with the use of TIVA vaccine, inactivated vaccine, for boosting the immune response of sows. This study was conducted in 2 farms. Farm 1 was a 300 sow farm running on a 3-week batch basis. and Farm 2 was much bigger, 700 sows operated on a weekly basis. Both farms purchase PRRSV gills from an external source at 6 months of age. Then they vaccinated these animals twice with an MOB, with a commercial MOB, 4 weeks apart, and then they performed blanket vaccinations of sows 3 times per year. Both farms had 2 separated flows of weaners, so you can compare these two rooms having different animals subjected to different treatments, and Farm 1 was weaning at 28 days, while Farm 2 was weaning at 21 days of age. Both farms had been endemic for years for PRRS. At the moment of starting the study, both farms had still viremic animals at birth. The scheme of this study is as follows. In one group we have gills, and the other we have the adult sows. The adult sows were in this scheme of blanket vaccination, and the trial started 2 months after the last blanket vaccination. Nothing was changed at this point. For the gills, we administer a modified live vaccine, and then we administer 1 dose of progressives 4 weeks after the MOB. After insemination, sows were vaccinated again at 60 days of age with an MOB, and 1 group with administer progressives at 19 days of gestation, just before farrowing, with the idea of boosting the sow in this critical period. We examined the PRRS dynamics in the farm in terms of proportion of positive litters, incidence at weaning, seropositive piglets at weaning, and neutralizing antibodies at different ages, and then the incidence until the end of the nursery period. For the productive data, we recorded the total newborns and the proportion of stillbirth mummies, weaned piglets, and deaths after weaning. In one farm, we studied 953 piglets from 155 litters, and in the other, we examined 155 litters for a total of more than 800 piglets. The number of batches examined were different because both farms were operated with a different routine. The results of this analysis showed that mortality was influenced by vaccination. In the vaccinated group, we observed a significant decrease in the mortality before weaning that was about 15%. This reduction in mortality was together with an increase in the number of pigs born alive. There was an increase in the number of pigs born alive in the treated group. The interaction of the treatment and the number of pigs born alive was significant, suggesting also that there was an effect because of the size of the litter. Regarding PRRS incidence, the strategy of vaccinating before farrowing reduced the mortality, reduced the incidence up to 6 weeks of age, but after that, since the antibodies fade out, the incidence was the same in both groups. In other words, administration of this strategy of boosting before farrowing reduced pre-weaning mortality, increased the number of piglets born alive, but was not able to reduce circulation in the piglets in the nurseries because the antibodies fade out at 6 weeks of age. These prime booster strategies have been used in other pathogens, and one of the most common agents for which these strategies are thought is influenza A virus. In this first paper that I show you, the authors compare the use of different strains in a prime boost strategy. In this case, were 2 strains for H3 and 2 belonging to different clades. The design of the study was a little bit complex, so let me explain a little bit. There was a 1 control group, 1 control that received twice the same strain, this 08 here, so this would be a homologous boosting. Second group receiving twice this PA10, again homologous boosting, but for a different clade. 1 group receiving first 8 and then 10. Another group receiving 8 and 10 at the same time, but only once. And 1 group receiving 8 and 10 at the same time, but twice in a prime boost strategy. After a challenge, as you can see, the animals receiving twice the same were similarly protected than the animals receiving only ONS 8 and then 10, compared to the animals that receive a combination of 8 and 10 that perform worse than this heterologous prime boost group. However, when they examine the second group, I mean the challenge with PA10, as you can see here again, the homologous booster was very good, almost no infection in these animals. But when they use the heterologous booster, 8 and 10 in this case, against 10, the protection was significant compared to the controls, but was not that good compared to the homologous booster. This study shows us that it's not that simple. It's not just a matter of doing a prime boost, but it's also a matter of the sequence of the antigens that you are using. In this other study, in which the authors Lee and co-workers test several prime boost strategies for influenza using different commercial and autologous vaccines, they compare commercial plus commercial, autologous plus autologous, autologous plus commercial, commercial plus autologous, and then also tested live plus commercial. The results were not that good. In this case, they have the different groups, they expose the animals by contact with infected animals. And as you can see here, more or less, all groups perform similarly. Maybe the intensity of lesions in the lung was a little bit different for this group, but in general, the results were pretty similar. Surprisingly, in this case, the combination of live plus commercially inactivated vaccine did not produce a significant increase in protection compared to the other groups. So just going for the last slide before the question, some take-home messages about this prime boost strategy. The first one is to be clear that the immune response declines after several weeks or months in most cases, so some type of recall vaccination is needed. The second is that these booster strategies are aimed to revitalize the immune response. However, this strategy can aim at different things. For example, at widening the panel of antigens recognized, or to produce a more complete immune response. In each case, we will need different things. The third one is that the efficacy of these booster strategies depends on the number of factors. And these factors will include the sequence of vaccinations, the amount of antigen, the adjuvants, and the type of memory cells involved in protection in each case. The fourth is that in pairs, these prime booster strategies may help to increase the humoral response and the transfer of neutralizing antibodies to piglets. As a result, they may help to reduce pre-weaning mortality. And finally, in other models, for example, influenza, heterologous prime boost can be helpful to widen the panel of antigens recognized. As we see before, the combinations and the factors that are influencing these prime boost strategies must be taken into account. So that's all. Thank you for your attention.